Hey everybody, Alyssa here at Preferred Physical Therapy, where we help people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery. Today we're going to talk about the hip and how it might be related to your low back. We're going to go over a couple exercises and stretches that may not seem completely related to your hip. They may seem a little bit strange, but we oftentimes see that when people are complaining of hip pain, it's more often when they're pointing to their backside that there might be some involvement from the low back there. So we're going to go over just a couple things to see if they can help you. So we hear from a lot of people that they have hip pain, and then they point kind of back in this area. Oftentimes when they're pointing kind of back in the glute, the low back area, there's usually some involvement coming from your low back. So we're going to go over a couple things that may help counter that. Oftentimes we see that people who have a weak core tend to stand a little bit more tilted forward, which makes their hip flexors tight and puts a little bit more strain through back here. So we're going to go through an exercise to help engage that core, get our pelvis in more of a neutral position instead of a tilted position. So to do that, you're going to lay on a nice flat surface, whether that be your floor or your bed. And what you're going to do is you're going to have your knees bent, your head and chest is staying nice and relaxed. And here, you're going to kind of put your hands here just so you can feel your pelvis moving. I like to put them right on the bony parts of my hip bones. And so you're going to imagine you're drawing your belly button down to the table, flattening your low back as much as you can, like you're trying to smash a pancake down there. What you don't want to see is you're either lifting your chest or arching your back away from the table. So you're going to try to hold that. See how my bottom didn't lift up at all? I didn't lift up through here. It's not a crunch. You're just engaging those lower abdominals. And what I want you to try to do is be able to hold that contraction for about 10 seconds, 10 times, until that gets easier, and then we can talk about some progressions moving forward. For the next exercise, we're going to show you an easy way to stretch out those hip flexors, or those muscles on the front of your thighs that we talked about that can get a little bit tight from having that more tilted pelvis. Make standing up nice and straight tall. A lot of times people feel like they're hunched forward and they don't feel like they can stand up straight without some strain in through the front. So what you're going to do is, again, this one's a little bit easier off a higher surface, like your bed, if it's nice and firm. Check to make sure that your bed is firm before you just lay on the very edge of it, as it can be a little bit scary that you might fall off the side. What you're going to do is, again, engage that abdominal muscle a little bit so your low back is staying flat against the table, and you're going to try to drop your leg up the side. Some people's legs may drop pretty far. Others, they might not even be able to get down to the base of the bed. However, you don't want to arch through your back. That's going to put an unnecessary strain in through there. So do try to do that little maneuver we just went over. If this isn't quite enough of a stretch for you, you can bring your other knee to your chest, which is going to intensify this just a little bit. But this is a good way to just let this muscle kind of try to relax and dangle further off. You're going to try to hold this 3 times, 30 seconds. Try on both sides. You might find one side is a little bit tighter than the other. So that muscle can be very tight in some people. So if any of that does cause you some discomfort or pain, try not to stretch through the pain. You may feel an intense stretch, but if it's giving you pain, whether it be in your hip or your low back, stop and feel free to leave a comment below or reach out to us, call our office, and let us know if there's any way we can help you with anything. Thanks. Hopefully those 2 exercises went all right for you, and they can help you get a little bit stronger in through your core and a little bit looser through your hip flexors. We hear a lot of times that people just feel like they're not taking full steps, or they get more tired when they're out walking with their spouse, and that oftentimes has to do with being weak or tight in different areas. So hopefully we can get you a little bit more energy, a little bit more stretched out, so you can go do the things you'd like to be doing. Feel free to check out our blog. We're going over how your hip pain could be related to your back pain in a little bit more depth. And feel free to check out any of our Technique Tuesday videos this month, where we covered a bunch of different things about hip pain, weak glutes, and see if any of those can be a benefit for you. Thanks for watching.